It's a situation you should only go through once in your life, and that's when you're dying. It felt like a broom handle was being pushed in my brain and my head was splitting apart. These are the words of the psychiatrist, Derek Hutchinson. This is exactly what he felt when he woke up, right in the middle of brain surgery. His brain was being pushed through his eye with a long, pointy object. He woke up during a lobotomy, the operation that changed him forever. Although he is considered very lucky because a miracle helped him get better, unlike many others like him who, unfortunately, were never able to recover from this monstrous intervention on the brain. A new progressive method entered the history of medical entertainment, almost instantly managing to mutilate an entire generation of mentally ill people. Without exaggeration, there were tens of thousands of individuals worldwide, including ordinary workers, various types of royalty, government officials' wives, and children whose parents wanted calmer behavior. Among those who left a significant mark in history was Rosemary Kennedy. This surname may sound familiar, and it's because she was the sister of the Senators Robert, Ted, and the well-known President John F. Kennedy. Rosemary was a beautiful, well-mannered, smiling girl and a member of the Kennedy family. At first glance, they look like a family from a Christmas advertisement, but everyone has its skeletons in the closet. Joseph Kennedy had 9 children, with Rosemary being less well-known. In family photos, she is presented as a charming girl with bright eyes and a warm smile. Yet some pictures showed her father tightly holding her hand, trying to handle her spirited temperament. Her birth was a struggle. In the early months of 1918, during the Spanish flu epidemic, her mother was in Brooklyn under the care of a nurse. When labor began, the doctor was late due to the flu's aftermath. In confusion, the nurse advised Rose to delay the child's birth until the doctor arrived by squeezing her legs. Unfortunately, this led to oxygen deprivation for the girl, resulting in serious consequences that she had to endure throughout her life. Rosemary learned to crawl, walk, and talk much later than her brothers and sisters. Everyone hoped it was just a matter of time, but as time passed, no improvement was seen. The age gap widened. She struggled with tasks like cutting her food and needed it pre-cut. She couldn't understand the difference between right and left. Her siblings suspected she might have epileptic seizures, but it was uncertain. A doctor frequently visited the house, and during these times, the other children stayed in different rooms, not daring to ask questions. The father was furious whenever anyone tried discussing his daughter's health, even though Rosemary seemed slightly more reserved compared to the other children. Studying was not easy for her. She changed several schools and ended up in a monastery boarding house. 2 nuns and a special teacher, Miss Newton, worked with her for days in separate classes, which, by the way, did not give much results. But the nuns were generously rewarded for their efforts. Kennedy gave the boarding house a new tennis court, which did not affect the development of his daughter. At 16, her reading, writing, spelling, and counting skills were reported to be at a 4th grade level, ages 9-10. As she grew older, her character became more and more complex. Many nights, Rosemary's cousin Anne Gargan recounted, the school would call to say she was missing, only to find her out walking around the streets at 2 a.m. It soon emerged that Rosemary was sneaking out, in the words of a fellow patient who shared many years of Rosemary's later confinement, to meet men in taverns, men who were happy to give her attention, comfort, and sex. Rosemary would often experience convulsions and fly into violent rages, in which she would hit and injure others during this period. Her father was especially worried that Rosemary's behavior would shame and embarrass the family and damage his and his children's political careers. Her erratic behavior led Joseph to begin investigating surgical solutions, and in November 1941, he found a neurosurgical procedure. It was gaining momentum at that time, promising to calm and make the patient less violent. Doctors affirmed this was a simple and, most importantly, reliable way to cure his daughter. However, Rose's mother didn't trust the procedure and instructed her daughter Kathleen to study it since the American Medical Association was against this experimental method. Kathleen made sure that this procedure would in no way help Rosemary and might even harm her.
Here the skull is thin enough to transmit light, and it can usually be perforated easily with a sharp instrument without damage to any important structures.
She shared these thoughts with her mother, but she did not yet know at that moment that the decision had already been made. Without the mother's knowledge, Joseph Kennedy authorized two surgeons, Dr. Walter Jackson Freeman and Dr. James Watts, to perform a lobotomy on Rosemary. After Rosemary was mildly sedated, we went through the top of the head, Dr. Watts recalled. I think she was awake. She had a mild tranquilizer. I made a surgical incision in the brain through the skull. It was near the front. It was on both sides. We just made a small incision, no more than an inch. The instrument Dr. Watts used looked like a butter knife. He swung it up and down to cut brain tissue. We put an instrument inside, he said. As Dr. Watts cut, Dr. Freeman asked Rosemary some questions. For example, he asked her to recite the Lord's Prayer, sing God Bless America, or count backward. We made an estimate on how far to cut based on how she responded. When Rosemary began to become incoherent, they stopped. This happened when she was only 23 years old. Once again, this highlighted the inadequate understanding of the responsibility of those performing lobotomies. To better comprehend Rosemary's story, let's revisit the brain surgery, specifically trepanation of the brain. Trepanation can be considered the initial step towards lobotomy. People have been practicing it since ancient times. The essence of trepanation involved removing rubble and bone tissue to access a specific area of the brain. Simply put, people drilled holes in the skull at a specific location. This method dates back to the Mesolithic era, around 8,000 to 10,000 years BC. Paleontologists have discovered skulls with evident trepanation marks from various civilizations, spanning from Central America to Greece and China. In ancient Greece, Hippocrates described trepanation in detail. They used this procedure not just for serious injuries, but also to remove skull fragments and ease brain pressure. Even back then, scientists knew that thoughts and emotions are closely tied to the brain, and they were trying to find ways to influence unusual behavior. In the 12th and 13th centuries, Greek surgeons recommended trepanation for conditions like epilepsy, melancholy, and madness. The idea was to create a hole in the skull to let bodily fluids and air escape. It was believed that this process would ventilate the demons causing diseases, letting them out like through a window. Human imagination then and now has been quite vivid, and societies have been rich with various theories about the world and the human body, often interconnected. Trepanation even found its reflection in art. Look at the painting Removing the Stone of Stupidity by Hieronymus Bosch. In this artwork, a scientist taking out a so-called stone of stupidity from someone's head. Similar ideas can be found in Dutch art and stories until the 17th century, where the saying to have a stone in the head meant being seen as stupid. Unfortunately, this idea of removing imaginary stones wasn't just in stories. Some medieval alchemists convinced people that there was a stone of stupidity, and taking it out would make someone's life better if they were considered stupid or mad. In 1888, a Swiss doctor named Gottlieb Burckhardt tried to help patients with schizophrenia and hallucinations by doing 6 brain operations with little surgical experience. He believed that mental illness came from specific issues in the brain. But it's important to remember that at that time, there were no modern tools for diagnosis. He used a trepanation set to drill holes in the temporal region, then opened the dura mater and removed parts of the cerebral cortex, sometimes using a sharp spoon. Although some patients became less violent, many experienced lasting neurological problems at that time. Some were even less fortunate. They either faced multiple complications or took their own lives. In 1889, Burke presented his work at a medical conference, but contrary to expectations, the scientific community was not supportive. Some ridiculed him, others called him a barbarian. Disgraced, he had to scale back his research. Gottlieb Burckhardt passed away in 1907 from pneumonia, nearly 30 years before the first lobotomy. He didn't witness the initial successful manipulations with the cerebral cortex. But don't think these experiments came out of nowhere. People already saw a close connection between the brain and human behavior. A good example is a case often called the man who began neuroscience. Phineas Gage was an American railroad construction foreman born in 1823. On September 13, 1848, when Gage was 25 years old, he was working in Cavendish in Vermont. leading a crew that was preparing the Rutland and Burlington Railroad by blasting rocks to make a roadbed. This was done by using an iron tamping rod to pack the explosive powder into a hole. Whilst Gage was doing this, however, the powder detonated, and the tamping iron he was using launched from the hole and entered the left side of Gage's face from the bottom up. The iron rod, which was 43 inches long, 1.24 inches in diameter, and 13 pounds, penetrated Gage's left cheek, traveling behind his left eye, entered through the left side brain, and exited his skull, landing 80 feet away. After the incident, Gage was thrown onto his back from the force of the iron rod and had some brief convulsions of the arms and legs. Within a few minutes, however, Gage was able to get himself up, speak, and walk with small assistance to a nearby cart so he could travel into town. Williams claimed that Gage was recounting his injuries to bystanders, and he did not initially believe the story, thinking that Gage was deceived. Gage had greeted Williams by angling his head at him and saying, "Here's business enough for you." Williams recalled that Gage vomited, which led to about a teacupful of his brain falling upon the floor from the hole at the top of his skull. Dr. John Martin Harlow took over the case of Gage soon after. Harlow reported that Gage was fully conscious and recognized Harlow at once, but was tired from the bleeding. In the next couple of days, Harlow observed that Gage spoke with some difficulty, but could name his friends, and the bleeding ceased. Gage then spent September 23rd to October 3rd in a semi-comatose state, but was able to take steps out of bed by October 7th. By October 11th, Harlow claimed Gage's intellectual functioning began to improve. He recognized how much time had passed since the accident and could describe the accident clearly. 4 years after his injury, Gage moved to Chile and worked taking care of horses and being a stagecoach driver. In 1860, he moved to San Francisco, California, where his mother and sister lived, and was suffering from an illness of which Harlow did not know the nature. However, his contractors, who had regarded Gage as efficient and capable before the accident, could no longer offer him work due to considerable changes in Gage's personality. Marlowe described him as follows: "The equilibrium or balance, so to speak, between his intellectual faculties and animal propensities seems to have been destroyed. He is fitful, irreverent, indulging at times in the grossest profanity, which was not previously his custom, manifesting but little deference for his fellows, impatient of restraint or advice when it conflicts with his desires, at times pertinaciously obstinate yet capricious and vacillating, devising many plans of future operations, which are no sooner arranged than they are abandoned in turn for others appearing more feasible. A child in his intellectual capacity and manifestations. He has the animal passions of a strong man. In this regard, his mind was radically changed, so decidedly that his friends and acquaintances said he was no longer Gage." On May 21, 1861, 12 years after his accident, Gage died after having a series of repeated epileptic convulsions. 7 years after Gage's death, his body was unearthed, and his skull and the iron rod were given to Harlow. To this day, both are on display at the Harvard School of Medicine. The brain damage causing significant personality changes was initially believed to be in the left frontal region of the brain. It wasn't until 1994 that advanced computer-based methods were available to examine brain damage comprehensively. They discovered that the damage caused by the rod involved both the left and right prefrontal cortices, responsible for emotional processing and rational decision-making, suggesting deficits in these areas for Gage. A later study used Gage's actual skull to create three-dimensional reconstructions, contradicting previous findings and concluding that the rod only damaged the left frontal lobe, not the right. Also, Gage suffered white and gray matter brain loss. He lost about 11% of white matter, crucial for brain connections, and about 4% of gray matter, vital for higher learning. The research suggested that Gage's recovery might be attributed to the regenerative capacity of white matter. To understand the impact of a surgical invasion of the brain, let's consider its overall function. The brain, roughly the size of a large coconut and shaped like a walnut, has a consistency similar to frozen butter. It consists of two large hemispheres, covered by a thin shell of wrinkled gray tissue, known as the cerebral cortex. Below the back of the brain lies the cerebellum, partially covered by the cerebral hemispheres. Each hemisphere is divided into 4 lobes, each responsible for specific functions. The occipital lobe processes visual information. The parietal lobe is involved in movements, orientation, calculations, and recognition. The temporal lobe deals with sound, speech perception, and memory, while the frontal lobe handles complex brain functions such as thinking, concept formation, planning, and the conscious experience of emotions. Although it might seem that each part of the brain has distinct functions, it's not entirely true. One part can sometimes compensate for the other's work. In infancy, the human brain is highly adaptable, enabling it to adapt and learn various functions even if one hemisphere is removed. However, as a person grows, the distribution of brain functions becomes more rigid. This could clarify why younger patients who undergo lobotomy in childhood often recover more effectively. In the 1930s, scientists worked hard to prove the theory that different parts of the brain have distinct functions. In 1935, at the Second International Congress on Neurology in London, Americans John Fulton and Carlisle Jacobson showed the results of removing parts of the prefrontal cortex of 2 chimpanzees. It didn't kill them. Moreover, this seemed to calm the chimpanzees, even though they lost cognitive abilities. At the Congress, there was a Portuguese, Egas Moniz. Having devoted most of his early years to politics, Moniz was a late starter in medicine. It was only upon retiring from politics in 1926, at the age of 51, that he was able to concentrate on his research in neurology. He was awarded the 1949 Nobel Prize for Physiology or Medicine for the development of prefrontal leucotomy as a radical therapy for certain psychoses or mental disorders. Promising observations of chimpanzees with the prefrontal cortex removed led Moniz to the idea that this could be done with hopelessly violent mentally ill patients, removing the entire prefrontal cortex or frontal lobes entirely. Moniz hypothesized that surgically removing white matter fibers from the frontal lobe would improve a patient's mental illness. This procedure was called leucotomy. In 1936, he published data on the first 20 operations carried out under his leadership. Moniz never performed a surgery himself, partially because of his lack of neurosurgical training, but also because he had limited use of his hands as a complication of gout. He enlisted his longtime staff member and neurosurgeon Pedro Almeida Lima to test the procedure on a group of 20 patients, mainly with schizophrenia, anxiety, and depression. The surgeries took place under general anesthesia. Instructed by Moniz, Lima performed 10 of the first 20 surgeries by injecting absolute alcohol to destroy the frontal lobe. Later on, Moniz and Lima developed a new technique using a leucotome, a needle-like instrument with a retractable wire loop. By rotating the wire loop, they were able to surgically separate white matter fibers. The first psychosurgery was performed in 1935 on a 63-year-old woman with depression, anxiety, paranoia, and insomnia. Moniz reported a total of 7 cures, 7 improvements, and 6 unchanged cases. Though his follow-up was mainly within the first few days of surgery and his determination of improvement was rather subjective, his publication was well received. It seemed to offer evidence of the benefits of psychosurgery. Lobotomized patients were also left with irreversible changes in their persona and were described as mental invalids and drooling zombies. For example, Moniz's first patient was less agitated and less overtly paranoid than she had been before, although she was also more apathetic and duller than Moniz had hoped. She had a few physical side effects such as nausea and disorientation, but overall struck Moniz as much improved. In the 1930s, diagnoses of serious mental illness were increasing, and yet knowledge of its causes or how to treat it was not. Incredibly, despite such jarring criticisms, lobotomies became a mainstay of surgical psychiatric treatment. Moniz began an advertising campaign for a new, wonderful operation which promised to cure everyone for a small fee. He sent thousands of letters and articles throughout psychiatric institutions in America. He took advantage of every opportunity to promote their operation. Washington Post and Time magazine even wrote about them. His followers took as an example the work of the Nobel laureate. One of them is Walter Freeman. Yes, the same neurologist who mutilated Rosemary Kennedy. In a savvy marketing move, Dr. Freeman and Dr. James Watts rebranded leucotomy, giving it a new name. lobotomy. Freeman believed that mental illness was related to overactive emotions, and that by cutting the brain, he cut away these feelings. The duo of doctors quickly gained fame, with little concern even after an unfortunate incident with patient number 5, who not only failed to recover but also developed epilepsy and urinary incontinence. Undeterred, they streamlined the process. In 1938, Freeman changed the technique, making a hole in the temporal region instead of near the top of the head. Dissatisfied with Moniz's Lobotomy tools, which lacked strength and sometimes broke during operations, they adopted a narrow knife-like instrument. This instrument decided the fate of Rosemary Kennedy in 1941. Drilling holes into Rosemary's skull, Dr. Freeman inserted a knife and began cutting away the frontal lobes of her brain. Strapped tightly to the table, she was awake and terrified throughout the procedure. Suddenly, she fell silent and lapsed into unconsciousness. The operation had been a catastrophic failure. Rosemary could no longer walk or talk. In response to her condition, Rosemary's parents separated her from her family. She was to live for the next 64 years hidden away in institutions, needing full-time care. In Rosemary, the hidden Kennedy daughter, author Kate Clifford Larson stated that Rosemary's lobotomy was hidden from the family for 20 years. None of her siblings knew of her whereabouts. While her older brother John was campaigning for re-election to the Senate in 1958, the Kennedy family explained away her absence by claiming she was reclusive. The Kennedys did not reveal that she was institutionalized because of a failed lobotomy, but instead said that she was deemed mentally retarded. By 1942, the duo had performed over 200 lobotomy procedures and had published results claiming that 63% of patients had improved, 23% were reported to be unchanged, and 14% were worse after surgery. Dr. Freeman kept working, coming up with new ways to improve the lobotomy procedure, sometimes exploring unconventional and even unusual approaches. After 10 years, Freeman developed a transorbital approach based on the work of an Italian doctor, Amaro Fiamberti, who operated on the brain through his patient's eye sockets, allowing him to access the brain without drilling through the skull. After experimenting with novel ways of performing these brain surgeries, Freeman formulated a new procedure called the transorbital lobotomy. Freeman lifted the eyelids and inserted a knife, delicately tapping it through the thin eye socket wall and into the brain tissue. He maneuvered the knife in different directions, left, right, up, and down. After a few minutes, he repeated the procedure on the other side. The entire process took only a brief time, and the patient awoke as a completely transformed individual, considerably calmer but noticeably less expressive of their humanity. By 1950, Freeman's lobotomy revolution was in full swing. Freeman was a showman and liked to shock his audience of doctors and nurses by performing two-handed lobotomies, hammering ice picks into both eyes at once. Freeman usually wore neither gloves nor a mask during these procedures. In 1951, one patient died when Freeman suddenly stopped for a photo during the procedure, and the surgical instrument accidentally penetrated too far into the patient's brain. But this accident didn't stop him from his medical passion. Freeman traveled across the country, visiting mental institutions, performing lobotomies, and spreading his views and methods to institution staff. His patients often had to be retaught how to eat and use the bathroom. Relapses were common. Some never recovered, and about 15% died from the procedure. In July 1952, Freeman performed 228 transorbital lobotomies in a 2-week period in West Virginia for a state-sponsored lobotomy project dubbed Operation Ice Pick by newspapers. Certainly, there were critics. Many argued that slicing through brain matter like butter couldn't genuinely restore mental health. Doctors openly engaged in a debate with Freeman, presenting their concerns to the American Medical Association. One of the doctors later expressed, "I am terrified of the whole army of zombies who multiply after these operations. I think that all lobotomies brought to the world more mentally disabled people than they healed." Despite the medical community's skepticism, Freeman became more proud. He even declared one day that he would rather be wrong than boring, and as you can imagine, such an approach couldn't have had any positive consequences. By 1960, Freeman worked exclusively in private practice. Not a single public hospital had anything to do with him. In the United States, approximately 40,000 people were lobotomized, and in England, 17,000 lobotomies were performed. Freeman had personally performed as many as 4,000 of them. A large number of patients were gay men in an attempt to change their orientation. More lobotomies were performed on women than on men. A 1951 study found that nearly 60% of American lobotomy patients were women. He lobotomized 19 minors, including a 4-year-old child. One of Dr. Freeman's patients was a 12-year-old boy named Howard Dully. His mother died of cancer when he was 4 years old, and his father remarried a woman named Lou. When Dully was 11 years old, his parents brought him for a consultation with Dr. Walter Freeman. As reported by Damn Interesting, his stepmother described him as unbelievably defiant. Dully was a withdrawn boy who liked riding his bicycle and playing chess. He occasionally fought with his brother, disobeyed his parents, and stole sweets from the kitchen cupboards. He was an average child, perhaps a little unruly, but nothing that would strike one as exceptional for a boy of his age. He said her stepmother was strict and treated him differently than his siblings. Dully recalled how his first meeting with Dr. Freeman went. He was warm, personable, and easy to get along with. Was I fearful? No. I had no idea what he was going to do with me. The lobotomy took place a couple of months after that meeting. He remembered being wheeled into an operating room on December 15, 1960, just a few days after his 12th birthday. The last thing he remembers was being subjected to electric shocks to sedate him. When he became conscious the following day, he felt a severe headache and his eyes were bruised and swollen. I was like a zombie. I had no awareness of what Freeman had done, he said. People freak out when they realize the person they are talking to had a lobotomy, he says now, 47 years later. They expect me to be drooling. Moreover, in 2007, Dully published My Lobotomy. The memoir relates Dully's experiences as a child, the effect of the procedure on his life, and his efforts as an adult to discover why the medically unnecessary procedure was performed on him. After a lobotomy, people's behavior changed, and some initially showed improvement in the first weeks. Depressed patients seemed happier, and those with schizophrenia appeared more normal. However, this improvement was just a surface change that people liked to remember. Besides the death risk, cutting brain fibers led to various problems, including seizures, coordination loss, urinary issues, and paralysis. Patients became apathetic and emotionally unstable, and their intelligence suffered. Many lost the ability to speak, think critically, and make plans. Freeman himself admitted that a quarter of patients ended up with intellectual abilities similar to a pet. He also acknowledged that frontal lobotomies often caused unpredictable epileptic seizures. In some cases, seizures happened shortly after the operation, while in others they appeared 5 to 10 years later. Epilepsy developed in 30 out of 100 cases. Even if a lucky patient avoided epilepsy and retained their intellectual abilities, negative symptoms returned after 5–15 years as the frontal lobes grew back. Repeating the operation worsened the intellectual deficit. While we discuss lobotomy, another often used method for pain relief was electroconvulsive therapy, ECT. Interestingly, this therapy had its origins in Roman slaughterhouses, where it was employed to immobilize pigs before slaughter. Workers would use a large clamp with metal discs at the ends, supplying electricity to stun the pig, making it easier to handle. A psychiatrist witnessed this process and immediately began developing a similar method to manage human behavior. In the 1930s, electroconvulsive therapy emerged through this exchange of experiences. Although it didn't involve cutting into the brain like lobotomy, this method still had harmful effects on brain activity, leading to memory loss, disorientation in space and time, and, in extreme cases, death. Notably, Ernest Hemingway, who suffered from depression and paranoia, became a victim of electroconvulsive therapy. After 20 sessions, he experienced memory loss and lost the ability to write. What these shock doctors don't know is about writers and such things as remorse and contrition, and what they do to them. Well, what is the sense of ruining my head and erasing my memory, which is my capital, and putting me out of business? It was a brilliant cure, but we lost the patient. Shortly after expressing these thoughts, the writer took his own life. Despite its destructive effects, electroconvulsive therapy continues to be used today, but only in extreme cases when other treatments prove ineffective. Back in the day, it seemed like a cost-effective solution. During World War II, psychiatric wards in Veterans Administration hospitals were filled with soldiers returning from the front with severe trauma. These patients often exhibited extreme emotional agitation, requiring a significant number of nurses and medical personnel to manage them. Lobotomy appeared to be a cost-effective solution. The Veterans Administration Clinic quickly organized accelerated training courses for lobotomy surgeons. This cheap and straightforward method allowed for saving up to $1 million per day. Today, lobotomy is remembered with horror and caution. It is mainly represented in popular culture, especially in horror films. Despite Freeman performing the operation until 1967, interest in the procedure gradually declined. In 1950, a convenient alternative emerged: the drug chlorpromazine, the first antipsychotic in history. In 1954, reserpine, promoted by the state as a chemical lobotomy, joined the list of alternatives. With these new non-surgical methods available, the medical community eventually abandoned this truly barbaric operation. While Freeman performed his surgeries, his patients lost their identities. While Kennedy built a political career, Rosemary had to relearn how to walk, facing unimaginable challenges. Meanwhile, as Lou fought for her maternal authority, Howard Dully was being prepared for his operation. Lobotomy was a tragic mistake during a time when medical experimentation methods were imperfect. While Freeman traveled performing procedures on vulnerable individuals, truly sick people often received no effective treatment because better alternatives were not yet available. Now, after all these years, it's hard to say if lobotomy did more good than harm. Regrettably, such a drastic procedure was considered a solution to the complexities of the human mind. It's heartbreaking that, in the quest to understand our brains, people had to endure such terrible procedures. Of course, we hope to believe that these sacrifices were not in vain, and that the procedure contributed to humanity making better choices in understanding mental health.